aging population grows, experts say there aren't nearly enough medical specialists who care for older adults. That demand is part of the reason why the University of Wisconsin School of Medicine and Public Health is working with Madison's Veterans Hospital to train up-and-coming doctors in the skills they'll need, going well beyond the books. Our Madeline O'Neill is here to show us how. Maddie.
Well, Amanda, one report estimates a shortage of 27,000 geriatricians by 2025. And regardless of specialty, knowing how to treat problems specific to older adults is a skill set all doctors will need. So UW is putting future physicians to the test.
Good morning.
Good morning. Doctors have to be ready to answer to all kinds of calls.
What brings you into our clinic?
I fall over every now and again.
Any patient problems from head to toe, which tend to get a little more complex with age.
Are you on any medications for your diabetes?
Real problems call for real solutions.
Yeah.
And real situations.
And then any drug use besides what's prescribed to you by your doctor?
No, there's plenty of stuff that's been prescribed. I figure that does me for drugs.
Or at least realistic.
It was actually very realistic. Okay.
It could have fooled me, but what you're watching isn't an actual doctor's visit. It's a simulation being monitored with volunteer actors following a loose script.
Their answers were very realistic. They did a great job of creating these pretty rich stories of details.
The medical residents, like Johanna Potterella, are as real as can be.
The reason that I want to go into oncology, and that's kind of what led me to internal medicine, is the ability to create such a special relationship with these patients.
Patients who are aging.
There will probably never be in the near future enough geriatricians, geriatric psychiatrists, and other geriatric health providers to meet the needs of our aging populations. In effect, it's something along the lines of a geriatrician for every 15 to 20,000 individuals.
That's why Dr. Steve Barzy says the University of Wisconsin is one of a handful of medical schools requiring geriatric training for all internal medicine residents and select medical students.
We know that the majority of people that go through our medical school and through our residency programs are not going to become geriatricians, but we feel that all of them need to have those basic skills, and so we're geriatricizing this physician workforce.
Get up from the chair.
These once-a-month simulations take residents like Potterella through visit scenarios for concerns surrounding falls, memory, and depression, which can all look different with age.
It took a little while to get reoriented.
When we deliver care to older adults, there's nuanced ways that we have to kind of think about things so that people can stay independent and live successfully.
Okay, okay.
Potterella can carry the skills she's practicing and receiving feedback on during this session along with her in her desired career treating cancer patients.
You need to know how to deal with things just beyond just the cancer and its treatment, and things like we're seeing today are things that definitely could come up in a clinic visit for that.
Real knowledge that will come in handy for years. And countless doctor visits to come.
Good morning.
Good morning.
Mr. Kant?
Yes.
Now, these simulations are based on national guidelines and evidence about what works well with older patients. And as we see in healthcare in general, those who live in rural areas have less access to doctors specializing in geriatrics.
And this is definitely really important for them to learn. Thank you so much, Maddie.
You're welcome.
Let's get a